I am Sabrina Bates, and I'm a group member in the Hitman group, HIT standing for Human Intravenous Therapy. I have written a training manual to how to start an IV.
My name is Chastity Lee, and I'm a nurse, and I'm going to be instructing how to properly place an IV. Before we get started, I want to name some of the supplies that you need. Number 1 is gloves. 2, I will need my tourniquet. I will have alcohol swab, my needle. I have my bag of fluid and my IV tubing. The very first thing that I do, and it's called priming your bag, priming your tubing, so you're ready to actually insert the tubing as soon as you get your needle in place in the arm. I will spike my bag. And spiking the bag is just attaching the actual tubing up into the bag. And you have a little controller that lets fluid drop. And I can control this. So as I have done this, I'm going to, we'll watch the fluid go through the bag, which is what is being spiked. You will notice, you will see it coming through. It's already been primed, so now I'm ready to start the other part. I will apply my gloves. We're going to be inserting into the brachial area, which is in the middle of the crease of the forearm. This tourniquet will help a vein come to surface from applying pressure at the top above the site. At this point, you will feel around for a vein. I like to try to stick the biggest and the most superficial vein that I can find. The next step, I know where I'm going. I know where I'm going to aim at. I'm going to take my alcohol swab. I will clean the site really well. This is prevent any infection from the foreign object actually going into the vein. The 2 infections most common is phlebitis and cellulitis. The site is clean. With the bevel side up at the needle, which is the hole in the tip of the needle, bevel side up, after pulling the skin back a little bit to make some tightness, to make it easier to go in, I will hold my needle at a 30-degree angle. I will insert. When you see a flashback of blood, you're in. So you have your tubing ready that's going to be connected. Disconnect. And I will attach my tubing. And I will run it to make sure it's coming, it's dripping. It is, I'm not having any problem with it. It's flowing in with no problem. I will wrap around to keep from it pulling. And I will take the tubing again. And at this point, I will watch it a few minutes to make sure that we're not seeing any blood veins, in which you would look for swelling or redness around the IV site. Thank you.
Thank you.